Hi. Recently, a lot of patients have been coming to me with vaginal itching. Something so common and so immaterial can turn out to be really sinister. So, if you have persistent vaginal itching or discharge and you're not getting cured in spite of antibiotics and repeated course of vaginal pessaries, then it is time that you think about other causes. The reason for me coming out to you and reaching out to you is because recently I saw young unmarried girls coming to me with the same problem. Once we examined, even though on the naked eye examined or when we examined them in the OPD, we could not find any obvious suspicious lesions. We did a pap smear or a liquid based cytology, which is quite common and everyone is aware of it these days, and it was negative. But when patients do not get cured by even antibiotics, then it raises suspicion for us. And we test for something called as HPV virus or the human papilloma virus. Like corona is a virus and everyone is aware of it, so is HPV, and it tends to infect the female organs and it gives rise to sometimes no symptoms at all, and it can stay sleeping in your genital tract and get activated suddenly, or it causes changes which eventually may lead to cancer. So talking about young girls, I would like to state an incident where a young girl, unmarried, she came to me with a persistent vaginal itch and discharge, not responding to antibiotics. We did a pap smear which was negative. We also did an HPV, like I said, and it turned out to be positive for one of the high-risk HPVs. Once we diagnosed that, we knew that there is something more to this problem. So we went ahead with the colposcopy, which is nothing but a visual examination with the help of a good camera with higher magnification and some filters and some stains to give us a closer look at the cervix. Once the cervix was examined on the colposcopy, we could identify the areas which were suspicious and took biopsy from them. When the biopsy the results came, we were quite surprised. But this has been happening for some time, and that is why I would like to raise awareness for the same. When we talk about cervical cancer, we usually talk about a growth or bleeding or foul discharge or necrotic bits coming in. These are symptoms of late stage cervical cancers. If we talk about the initial symptoms, cancer doesn't come immediately in cases of cervix or the mouth of the uterus. How it comes is via HPV in most common cases, and the HPV tends to stay because of varied factors, multifactorial, like the types, the high risk types, or if you are a smoker, or if you have more partners than one. These are the reasons where HPV infection tends to stay, and it causes changes in the cells which eventually lead to cancer. So what we found on the colposcopy and after taking a biopsy is that she was maybe 1 or 2 stages just short of being cancer. The good news is that we can detect such lesions even before they rise. They tend to form cancer and they can be easily treated. Now, if we have something as sinister as that, many people think that's the end of the world, or they have difficulties thinking about their life partners and future childbearing. But no, as gynae oncologists, we do have treatment offerings for you where we tend to take out only the infected part or the affected part of the cervix, take it as a whole, so that the whole area where the cancer tends to rise, that is removed, sparing the cervix, sparing the uterus, so that you can have childbearing in future and you can get married and have babies later on. Having that, your pre-cancer or cervical intraepithelial neoplasia is also cured. But it is very important to take note of any vaginal symptoms that you are having. and do get tested for HPV. It is something so simple, but I see in my OPD a lot of people being unaware of it. So take this note and do consult your gynecologist or gynae oncologist if you have persistent vaginal discharge which is not responding to treatment, or you have pelvic pain, bleeding right after intercourse, or having urinary problems which are not getting treated. So act fast, get tested and stay safe. Thank you.